video, got everything running for that, and do our lab safety agreement. And I know not everybody has their lab manuals, okay, but hopefully everybody will have that before Tuesday. Anybody who might not have it before Tuesday?
Well, they have it in the
They do. They've got it. Was that at the Parham Road campus?
This was, well, I had a special order earlier this week.
Okay. But they did get them in. I know they're at the Parham Road campus, and they said they should be here downtown campus. So if they didn't get here yesterday, hopefully they got here today.
Is there a book to this class?
The actual book is when you get the lab manual, it's going to come with a card, okay? It'll come with this card.
This card.
And you'll get that, scratch the code off, and the link that I have for you on that Connect website under assignments, when you open that PDF document and you see the link at the bottom, that's where you use the code that comes with it. All that does, though, is give you the e-text. If you want a paper copy, you got to order that. I think it's like $35.
It was $44.
$44.
With shipping.
With shipping.
Yeah, with the shipping included, it was $44 because you get a discount for having the design, like reading it on the computer.
Right. Yeah. So.
And with the menu, I'm sorry, that comes with the book you said? That access? Is that what you're talking
The
about?
lab manual comes with that code.
Gotcha.
And the link that I give you is where you'll use it. Now, if you've done the free trial, the trial access, okay, after the end of it, it'll ask you to put that code in.
Okay.
You don't have to put it in until the end of the access.
Right. And you said we could purchase it separately, right?
Purchase.
That whole thing, the access thing?
Actually, the lab manual comes with it. It's sold as one huge thing.
Oh, because, yeah, okay.
And you'll be using it in part 2 also, the lab manual. And the textbook too. So once you purchase it this time, you don't have to purchase it anymore. So, okay, so let's look back a little bit at the terminology and these directions for the body. Okay, so anatomical position, supine, prone, superior, inferior, medial, lateral, proximal, distal, superficial, deep. Relatively easy. Okay, relatively easy. Now, one of the things to remember, because we are the organism that we are, we have a midline. Okay, supposedly, if we were cut straight down the midline, we'd look the same on both sides. Anybody ever seen Body Worlds? No? Okay, it was the coolest exhibit ever. But anyway, okay, so it was like slices of everything. People, heads, brains, organs, everything. You know, just slices of it. It was really cool. Now, cut straight down through the midline. We should look the same on each side. So, midline, middle. Okay? So we have what's called medial, anything away from the midline, lateral. So, medial, lateral, think of every piece of the body having the ability to do that. When we think about superior, inferior terms, we are probably used to, okay? Superior to the top, inferior to the bottom. Our terms for that, we usually think towards the head, all right, towards the bottom. So, for the head, this is termed cephalic. Tail, caudal. All right? Ever heard of a caudal tail? All right, it's what happens as organisms are evolving, as they are developing. 1 cell, 2 cell, 3 cell, and so forth. If an area is far from the body, it's going to be distal. The closer to the body, proximal. So these are going to be terms that you're going to be getting familiar with. So we usually say superior versus inferior, medial versus lateral, proximal versus distal, superficial versus deep. Superficial usually meaning the skin top, the area, the outside, okay? Deep going into it. We're going to have anterior versus posterior, all right? Anterior, also known as ventral, all right? Posterior, also known as dorsal. A way that I kind of remember this, dolphins have a dorsal fin on their back. All right, so that's one of the ways I use to think about it. These are directional terms. These are the terms that when you use the term, or when you write the term, or when you read the term, it's letting you know something about the patient. Start using them now if you have to, you know, as you walk through the grocery store or whatever. Just look at them and go, got a piece of paper on your dorsal side. And see if they know what you're talking about. Okay? I like to trip people out like that. You know, like one of my terms that I just love, sternocleidomastoid. Love it. Anytime I can say some kind of crazy term that we have, I do. Because it makes everybody go, what? Then I have to kind of explain it to them, which gives me a chance to teach and talk about stuff, you know. And then everybody can look at me like, really? Yeah. Okay, so these would be terms and ways that we would be using superior, inferior, proximal, distal, that sort of thing. So just make sure to go through, read over these, begin to use them, begin to get used to them, okay? Because we will have them, there'll be a little exercise in Connect that you'll complete, and then we'll see it in lab, all right? Now, the other thing about terminology for anatomy and physiology, medical terms. When we talk about scientific, medical, when we talk about this science, terminology, well, on the inside back cover, but you can click on this within the e-text, okay? But scientific terms, we usually end up with a term that's like this. Hypothalamo-hypophyseal tract. What did I just tell y'all?
You said what? What's the word?
Uh-huh.
If I saw it, I could paint it.
The easiest thing to do with terminology, because you're usually going to have your root term, all right? Cardio, myo, osteo, all right? You'll usually have something that's your root term. Usually have something to the beginning, something to the end. You can have both, okay? And it's telling you what it is, all right? And that's the best way that I would say is how you learn terminology. Now, one of the ways that the terminology differs than the rest of the English language, endings are different. Where in the English language, we might think of something being singular, it'll be plural here, vice versa, okay? These are the common, okay, terms for something that would be singular. the common endings for something that would be plural. When we begin to look at how this might be different, look at this term right here, thorax. Where is that? Right here. Now, under English language, okay, thoraxes. To make it plural, right? Even though it doesn't need to be plural, but anyway, okay. Do you see how it's a different thoraces? All right, so it's little things like this that you'll get used to. The more you use the terms, the more you read, the more you see, the more it'll just become second nature to you. All right, the ones, like whatever area you decide to go into for study, it'll even become more common for you. But let me see. Ovary. All right. A lot of us know ovary, one, okay? But for the most part, we've got two, all right? So we're ovaries. But it's not Y''S. Okay? So it's just some things that you've just got to kind of read over and get familiar with. Not a lot, okay? But a little bit. Now, remember how if we're talking about having a plan, a blueprint, think of this as the blueprint for a human organism. Now, take a peek at that for a second. Look familiar? Stuff you've all heard, correct? What's different? Just mentioned thorax. Thorax is part of what region, what area, what part?
The trunk.
My trunk. If I look at my lower limb, if I look at the foot, it's taking it piece by piece by piece and putting it together into an area, a region, a blueprint of the body. Does that make sense? So the head could be the frontal area, orbital area, the nose, the mouth, the ear, the cheek, and the chin. Now, what would be beneficial of making sure, if you were dealing with a patient, that you referred to it as being the orbit, rather than just saying the patient had injuries on their head.
It's more
specific.
You're specific. You're giving the other person direction. Okay? So, the easiest thing to do is just start looking these over and simply just becoming familiar with them. We will run across like acromial, because we'll come across the acromion, okay, when we get to the scapula for the naming. But once again, the dorsal side areas that are in the trunk, so on and so forth. All right? I could stand up here and read them all to you, but it's just stuff you're going to have to become familiar with. Now, does this look familiar? All right? Now, oh my God. Okay. This is just not good. All right. Okay. I am not feeling good at all. Oh my God. Can somebody take me to the emergency room? Okay. Come on now. I'm just hurting right here in my belly.
Or right in the belly.
Am I pointing? to my belly. All right. But isn't this what people will do? Okay? They'll come in, they'll go, hurt right here. All right? And then, you know, okay, well, let's take this apart. So, our abdominal area is in right, left, upper, lower quadrants. Each of those get broken down a little more, and these are going to be areas that you're going to want to become familiar with, okay? You'll want to be familiar with our hypochondriac. I know, weird, right? Because I have a totally different understanding of hypochondriac, okay? Epigastric. But now, think about this for a second. The naming, the areas, they're in relationship to familiar terms, familiar areas. For example, if it's up here, this is my stomach. Think about gastro, because you have gastroenterologists, for example, okay? But you hear gastro, what do you think about?
Colon. GI.
Okay, think about my gastro, my stomach, okay? Lumbar. What area is that? All right, it's going to, but on your body, where is that? On your body. Because people will come back and they'll be like, oh man, you know, my back is hurt. Where am I holding? I'm holding on my hip. Okay? But lumbar right here. Okay? Connect that to this middle area where you see the terms lumbar. All right? Does that make sense? How you can make this relationship to the areas. And for me to learn it, that's what I have to do. I have to make the relationships to it. Okay, that's where we're going to stop for the lecture for today.